我的朋友丹尼尔是瑞典人，他在中国做访问学者，他从2018年起在中国广州生活到现在已经将近6年了。这期间他工作、恋爱、结婚，也有了一个非常可爱的孩子。当然他的妻子是一位可爱的中国姑娘。除了在工作上交往的中国同事外，他的人际关系基本上是一群来自世界各地的在广州生活和工作的一群外国人。采访的是丹尼尔在广州就医过程当中的感受，和他对外国人来中国就医需要注意哪些问题的建议。需要特别说明的是，在这个视频中，为了保护被采访者的隐私，采用了数字人来代替被采访者来回答问题，请大家理解。Hi Daniel， 非常感谢你能接受我的采访。你当时是在什么情况下第一次在中国看病和住院呢？
After going on a bumpy road in Guangzhou, I got a herniated disc which caused intense pain along my leg. A year after that, when COVID started, I also got diagnosed with cancer and had to visit a different hospital for surgery and chemotherapy. The rest of the answers here will be mainly about these 2 periods.
当知道你生病的那一刻，你心里最强烈的感受是什么？
For the herniated disc, I think what I was feeling mainly was annoyance. I think we figured out what it was likely to be before we went to the hospital to confirm, and thought that if we were correct, it would mean that a lot of things would need to change for an unknown period of time while I healed, but that there was no choice really. For the cancer, I was just confused at first before I could get a diagnosis at a specialist hospital. Then, once we got it confirmed, it was very scary. Cancer treatment is scary at any time, but this was just about a month after COVID had started. And as the cancer treatment would lower my immune system, I was very worried that just going by taxi to the hospital would get me infected, and I would get 2020 type COVID on top of the cancer.
在整个看病、住院和手术的过程中，最让你感到意外的一点是什么？
The thing that always stands out to me is how quickly you can get things done in China. Almost always, whatever the problem, you can get to see a doctor and maybe start treatment the same day. Sometimes you need to change to a different hospital, or wait a day or 2 until there is a bed ready, but in general everything happens very quickly.
有没有一个具体的瞬间让你感觉印象特别深刻呢？
I think the best memory I have from the cancer treatment is hearing the nurses practicing their English outside the ward and laughing together. This happened more or less every morning.
在住院和治疗期间，语言有没有成为你的障碍？医生和护士是怎么跟你交流的呢？
I always have my wife with me, so she translates if needed. At the cancer hospital, most of the doctors also speak English, and some of the nurses spoke enough to be able to talk about things if the doctors or my wife were not there.
有没有那一刻你觉得你是被认真对待或者是被安抚到了？
Yeah, but mainly from my wife. I guess in most cases, the doctors and nurses don't know how to approach those things in English, and even if they want to reassure, it is difficult to do so. However, I had an incident at the cancer hospital where I fainted in the bathroom, and my wife had to get some nurses to carry me out and try to wake me up. And while my wife was at my side trying to get me to respond and comfort me, the nurses did all kinds of things to help out and get me comfortable. Very rapid response as soon as something happened, and I don't have clear memories of it, but I know lots of things were going on, and I came back to consciousness pretty quickly.
如果跟你在你自己的国家就医经历相比，中国医疗最大的不同是什么？
I have had very little experience with healthcare in my own country, but did have minor surgery twice, compared to how healthcare, especially being hospitalized, has been for my friends and relatives. I guess the main difference is that things happen faster in China. There are many more hospitals here, and many more people. So I guess things happen faster by necessity, but both seeing a doctor, admittance, surgery, and everything can happen the same week here, whereas at home, it will usually be more spread out. unless there is an emergency. I also get the feeling that because there are so many people here, doctors see many more cases of common diseases than back home. I know the scanners I do for my cancer checkup must give a lot of data and experience to the doctors and technicians. There are 4 scanners running almost continuously all day, every day. My guess is they see several hundred times more scan results in a year than the average doctor back home. On the negative side, hospitals here are noisier, which is largely due to the patients and their families. Much more could be done to get families to respect other patients here. For instance, while doing chemotherapy and feeling sick and wanting to throw up all the time, I was also stuck in a room with old ladies burning incense and spraying all kinds of stuff with strong smells for their husbands who were in the same ward. Similarly, I remember the same old ladies consistently turning the AC off at night in the middle of Guangzhou summer, so I had to get up and turn it on again. This made the hospital visits worse, and more should be done to stop that sort of behavior. These kinds of things happen all the time in shared wards everywhere. But back home there is much more understanding for the fact that there is more than one patient in the ward, and you need to modify your behavior to respect all the sick people, not just do whatever you want.
这次生病治病的经历，让你对在中国生活的安全感有没有影响？
I think what my experiences with Chinese healthcare have shown me is that they do not discriminate in any way. If you are sick, you get treated, and the treatment is usually the same as is standard anywhere else. My time in the cancer hospital is perhaps the best example. At that time, in early COVID, Chinese society in general were very paranoid about foreigners spreading COVID, despite the fact that almost 100% of everyone in China who got COVID got it from a Chinese person. It would have been easy for the cancer hospital to make up some reason not to treat me, because they didn't want the risk of foreigners, but that didn't happen. Instead, my surgery and several rounds of chemotherapy were never an issue, and I was not treated any different from the other patients.
它有没有改变你在中国生活，或者是你在国外生活的一些看法？
Not really.
如果对在中国就医的外国人说一句关于看病的建议，你会说什么？
I would first of all want them to know that they can afford to go to hospital in China, which may be different from their home country, especially if they are American. Even pretty serious surgery and treatment is cheap in China, and since most foreigners who live in China earn well, they can afford it. I would also like them to know that healthcare here is fast and efficient, and that the doctors and technicians go through most standard procedures dozens, if not hundreds, of times more often than doctors in most other countries, thus having more experience. Other things worth knowing is that you need to register at the hospital first, and that if you think you will need them, you can print all your scans and reports in special machines. If you think you may need to change hospitals, you should print these things, because the hospital does not keep your records in the same way as back home.
也特别感谢你能够把在中国看病的经历分享给我。